ReMar nurses, it's that time. This is our critical thinking exercise right now. This is called Save the Patient. This is called Save the Patient. I will be playing the patient. You will be critically thinking. I'm going to give you my symptoms. You need to put immediately, what is my issue? Immediately, not 5 minutes from now. I'm going to have multiple different issues. I need you to critically think. Put on your nursing hats. It's time to get down. Also, we're doing critical thinking because you guys know this month I am doing my free critical thinking for NCLEX workshop. It is for International Nurses Day that I'm having. Over 2,000 nurses have already signed up for this workshop all over the world. 2,000 nurses are going to be representing their country, wherever you're from. We have people from the United States. We have people from Haiti. I have to shout out my Haitian nurses. I love y'all so much. We have people from Jamaica. We have people from Somalia and Nepal and Ghana, the glorious Ghana. Are you in on this workshop? You need to please go to my website, remarnurse.com, so that you can get started. Also, because it's International Nurses Day coming up, we are doing free international shipping on the virtual trainer plus $140 off. I have not done this before. International shipping, do you guys know how much it costs to get a package to Liberia? Don't worry about it. I got you covered, right? Anywhere in the world, it's time for my nurses to pass NCLEX. And so we're doing this little workshop, critical thinking, because this is a issue that, everybody, no matter where you're from on this planet, you need to be at this workshop. Shout out Fiji in the house as well. Team Somalia is here. I'm so happy. Listen, we're about to do a critical thinking exercise. So I'm going to give a symptom, and I may only give one symptom, and I want to know who's going to guess it. Are you ready? Are you ready? Come on in. Here we go. All right. First symptom. I'm a patient. I come in and I say, or you see that I have a barrel chest. My chest is irregular. It is barrel shaped. What is my condition? Come on, quickly. I need you to quickly. All right. Luma, as I read the comments, you says, I pass since, but I can't seem to have enough of Regina's knowledge. Play this game. NCLEX passer representing Finland. Finland in the house. International Nurses Day is coming up. Where is your beloved home? Okay. Yes, I'm wearing a patient's gown because I am playing the patient today, and you are my nurse. You're my nurse. I'm trusting myself with the ReMar nurses. I have a barrel chest. What is my condition? I see the right answer already so quickly. Yes. Barrel shaped chest. I have COPD. COPD, guys. And listen, I went through quick facts for NCLEX and I went through the VT workbook. Look at my VT workbook. I went through the VT workbook for my conditions for tonight. All right. So if you are not getting them right, then you need to get back into your studying program. Okay. You need to get these fundamentals down. This is a part of critical thinking. When you critical think, you are looking into are you looking into the past or are you looking into the future? Which one? Into the past or to the future, right? I see somebody say emphysema as well. I'll take emphysema, but I'm really looking for COPD. All right. COPD. That's the answer I'm looking for. And critical thinking, you're looking into the future. You want to know, what issue could my patient potentially have? If I give you one symptom, where are you going to take me? How are you going to anticipate my care? That's how you pass NCLEX. All right, I'm moving on. What if I have a greenish, rusty sputum? What if I'm coughing, and you see that my sputum is green and you see that it has a rust color to it? What condition does your girl have then? What condition do you have? This is what it's all about. At a moment's notice, are you in or are you out of this nursing thing? All right. If I have a greenish, rusty sputum, is something going on? Is it going on in my upper airway or is it going in the lower airway? It's going into the lower. I'm having what kind of issue? That's not normal. Not normal. Should you have sputum? Should you have sputum at all? And if you do have sputum, what color should it be? I see it. Good job. Good job, Day. Good job, Sharon. I'm having pneumonia. I am having pneumonia. And we got to get to me quickly. All right. We got to get to me quickly. All right. My next condition. Good job. Some of you guys are 2 for 2. My next condition. This is condition number 3. What if I have a beefy red tongue? What if my tongue is beefy and it's red? What's wrong with me? What's going on with me? Shout out. I have over 200 nurses right here on a Monday studying for NCLEX. I am sick, y'all. I'm the patient. I like that. Ray says, if I have some green rusty sputum, I got a super infection. All right. All right. No. So if I have a beefy red tongue, that's where we are now. We moving on. This is a quick exercise. If I have a beefy red tongue, I am having an issue with my blood. I am having what kind of issue with my blood? I'm having anemia. I'm having pernicious anemia. Here we go. Moving on. All right. If I have Trousseau sign, if you see me and I'm having Trousseau sign, what is it? If I'm at the dinner table, I see this all the time. I saw it all the time when I was in the nursing home. I'm not in the nursing homes anymore, but I do miss it, right? So if you have a patient and you see your nurse's aides grabbing vital signs and the patient has Trousseau sign, right? They have Trousseau sign. What does that mean? What does that mean to you? What level is low? What's going on with that patient? What's going on with that patient who has Trousseau sign? Yeah, I get it. Martha says, I have pneumonia and no symptoms. Yes, that's called walking pneumonia, right? Where you look good on the outside, but inside you have a very large, serious infection. So I hope that you're getting treatment for it. And that you're continuing to get well and studying with me. All right. So if I am seeing Trousseau sign, then I have tetany. And if you don't know what that word is, I want you to look it up. If you're sitting at home tonight and you don't know what these signs are, or if I'm saying words that you don't know, it is so important that you take the initiative today to write it down and look it up. Because the worst thing that can happen is for you to be studying and you don't look it up and say, oh, I'll get to it later. And then on NCLEX, you see it. Or the night before the exam. This is what happens. The night before the exam, when you're supposed to be relaxing and preparing your mind, you're laying in bed and all of a sudden you hear my voice and you hear me say tetany. And you're like, I never looked it up. Oh my goodness. What else don't I know? That's what happens. So look up tetany, all right? I'm moving on. The next condition that I have is, okay, I come in as your patient and I have Turner's sign. I have Cullen's sign. What is going on with me? What's wrong with me? Oh man, I do drink a little bit. I drink a lot. I drink like 8 beers a day and I have Cullen's sign. When you look at my abdomen, and it's there. It's bam, right there. What is it? What are you going to pick? What's going on with me? 8 beers a day, Cullen's sign. That's all I'm going to say. That's all I can say about it. But I need these quick answers. I need y'all to put these answers up a little bit quicker because this is one that this definitely you should know. I got this right out of the quick facts for NCLEX. This is the nursing student's best friend. If you're in nursing school, okay? If you're in nursing school, all right. So I said I drink 8 beers a day and I have Cullen's sign. I am not having a pregnancy issue. No, I am not having, I'm not having gallstones. What am I having? It is that, Marcia. It is pancreatitis, okay? Pancreatitis. That's what it is. Okay. All right. Okay. Next condition. Next condition. Let me pick it. I'm coming in. I got a cough. I have a fever. I'm not feeling well. I feel achy all over. I really don't want to do anything. I don't want to do anything. And you draw some blood and you see that the CD4 count is 100. What is the issue? What is that issue? Put it on the screen right now. Put it on the screen right now. What's the issue? And I said a word. I said a major medical word that anytime you see this word on the NCLEX exam, you better be thinking about this condition. I said, I'm feeling achy. I got a cough, a sore throat. I don't want to do anything. And my CD4 count is 100. What is this issue? What is this issue? If you need this book, you can go to ReMarNurse.com. If you don't have this, you can also get this on Amazon as well as eBay now. My book is on eBay. It's on Amazon, and you can get it. All right. So I see some of the answers. I see HIV, but it's not, I need you to take it a next step further. HIV is not what I'm looking for right now. Even though I said CD4 count, it is appropriate for you to know the reference range of a CD4 count. So because I said the CD4 count was what number? Because I said it is 100, then I have moved from HIV to what? HIV to AIDS. Yes. Yes. Okay. And you got to get those nuances. You have to understand that. All right. And this is how laboratory values come into play. They will be able to help you distinguish between one condition or another. All right. So remember, I was talking about how when they changed the NCLEX in 2023, they're going to give us the laboratory values now. You're not going to have to memorize lab values. Whew, right? Because what they found is that just memorizing laboratory values does not mean you're going to be a great nurse or a good critical thinker. It's how you can use those laboratory values to build a patient picture, okay? To build a patient picture. So we are talking about CD4 counts and when it transitions from HIV to AIDS, all right? All right, and so at that time, at 100, you're going to look for a patient with AIDS, okay? So if you got that wrong, just remember it. Okay, so I'm coming in now, new patient, okay? Delete that patient, now it's a new patient. Here we go. I'm coming in, all right, and I'm nauseated. I'm nauseated in the morning, but if I eat something, if I eat a slice of pizza, or if I eat a bagel, then I don't feel so bad. I don't feel so bad, right? And you take a listen and you take a listen with a Doppler and you hear another heartbeat. What am I? What am I? Everybody should get this one. Everybody watching should get this one. All right. All right. Yes. Before I even said the heartbeat, you remember when I got to stop. Alicia came on here and said, thank you, Regina. I finally passed my NCLEX RN. Congratulations. You got those big letters behind your name. It's real now. You did the hard work. And that is what I want for everybody watching. I want it to just pay off. This time that you spend now, I want it to be returned to you tenfold in a reward, okay? Tenfold in a reward. Congratulations. Amazing. Okay, we are talking about my feeling right now. I said in the morning, I'm nauseated. And in the morning, if I eat a slice of pizza or if I eat a bagel, the nausea goes away. It goes away. Now, I want somebody to tell me why pregnant women, because that's the condition, why pregnant women get nauseated in the morning. And some people say, well, my nausea is all day. That's true too. But why is it happening? Because if you have this book, if you've been in your virtual trainer, you're going to tell me right now. Put it on the screen. And if for those of you who don't have it, read the comments because somebody's going to put the answer. What causes nausea in the first trimester pregnancy time? What is the actual condition? Because it's a condition, right? We know it's a condition because if you do something, it goes away. It goes away, right? And so what we're doing is, this isn't the point of, oh, NCLEX questions are going to be just like this, because I see a comment that says, if only NCLEX was this easy. This is not the point of that. This is the point of allowing you to practice recognizing cues that will help you see a bigger picture. Right? Because a lot of people don't have the opportunity to do that the way they are currently studying. So what I do is I come on here, I do this for free every Monday for my community, right? For my community. And it is a way to check in on you guys and for you to check in on yourself, right? Okay, so I see the answer and the condition, absolutely. So the condition is hypoglycemia. The condition is hypoglycemia. And so what happens is during pregnancy, your blood sugar drops and you become nauseated, just like if you were a type 2 diabetic or a type 1 diabetic, right? And so this is also how NCLEX, listen, it is a place where you can get content from one condition and move it along to help you with a whole nother condition. That's why the content is so important, because yes, you can take the content that you know from diabetes mellitus, hypoglycemia, and you can put it to this condition right here. So if a pregnant woman is nauseated and we know it's because her blood sugar is low, then on the NCLEX exam, we can cross off the choices of, oh, give her insulin. We're not going to do that. We can cross off the choices of IV fluid. We're not going to do that. The correct answer, as you guys are putting, right, is carbohydrates, right? Carbohydrates. That would be the correct answer. And so, again, this is about reviewing concepts and content so that if you're put in a situation where, oh my goodness, you get it down to 2 answers, you're able to critically think to get the right one. And you don't have to second guess yourself, right? You don't have to second guess yourself if you know nausea in pregnancy is caused by hypoglycemia. All right, I'm moving on. I gotta go. All right. Okay, if I come in and I'm saying, hey, let me give you this. A college student comes to you, right? Yes. Share this video. Thank you so much. I just got to read this comment. Share this broadcast education, please, so that many people can benefit from it. And thank you, dear, for your kindness and support. Absolutely. And this is what I want you guys to understand. I'm doing this because I love you guys. All right. I love every success story. Every person that jumps on and say, I passed NCLEX RN. I passed NCLEX PN. I'm doing it for that person. There are people that will come on and they won't do nothing but put thumbs down. They won't do nothing but just talk about us, talk about why we're wasting our time, talk about, oh, this won't ever help. But I don't care about that. I am here for the person who is here to learn and who's here to practice. That is what makes ReMar great, our community. And we support each other no matter what, period. All right. There are many things. I'm an RN, MSN. There are many, many things I could be doing. But right now I'm sitting here with you. My kids are contained. Y'all, they know I got to study with you guys. They know. Right. And so I'm here because I really want somebody, one person to get their license. One person. All right. This is why I'm here. All right. So my next condition is this. I'm a college student. I come in here and I have a pain at the back of my neck. It's like right here. I can feel it, but I don't know what it is. What's the first thing you're thinking about? What is the first thing that you're thinking about? A college student. I've been living in my dorm room maybe 3 weeks. Oh my goodness. I've been living in my dorm room 3 weeks. It's a new environment. My neck is hurting and I have a fever. I'm having a fever too. What is it? What is it going to be? All right. What is the issue for me? Go ahead and put it up on the screen. Put it up on the screen. I'm waiting. Yes, I see it. I see it. There's some things here. There's some things here that are very, very significant. Meningitis is the condition that I want you to be thinking of. You guys know, how is meningitis spread? How do you get meningitis? What isolation precaution should this patient be in? Because you cannot have this patient walking around, because meningitis is very contagious. Stress, right? You said it's the stress in the back of the neck. Yes, baby. I want you to think meningitis though. I do. The stress of college will do it, man. But I want you to think meningitis because you have the, Brudzinski sign. So you have the pain, right? The nuchal rigidity. That's what they'll say as well. So think meningitis. It's really contagious and it's seen, among college students, because now you have people who were no longer living together, right? And now they're all living together. And if you're not protected against meningitis, then it's easy for you to contract it. And it's very serious because it is droplet. It is spread by droplet precautions. So that means, it's not spread by droplet precautions. You need droplet precautions, but it's spread droplet route. So if you're within 3 feet of somebody, you can get it, right? And so college students, if you're sharing a bathroom, if you're eating together, then this is what can happen. Okay. So, meningitis is what I was looking for. All right. Good job, guys. Good job. No, you got to use the droplet precautions with meningitis. You have to use that. All right. The next thing, I am a baby now. I'm a baby and I come in and I have, every time my mom feeds me, which is, my mom feeds me like 13 times a day. She's feeding me 13 times a day because she's so worried. And so my mom is feeding me 13 times a day. And every time she feeds me, I throw up. I'm a little baby. I'm 2 weeks old. Every time my mom feeds me, I'm throwing it up. What's wrong with me? And when I throw it up, it's green. It's green vomit and it shoots out everywhere. It gets all over my mom. It gets all over the walls, all over my crib. And I am just not keeping my food down. I'm not keeping it down and I'm not growing. And they're about to label me as failure to thrive, but it's not failure to thrive. I have something else. What is wrong with me? What is wrong with me? I'm looking, people are like, what? I don't know. What do you mean? Okay. So again, I'm a little baby. I'm 2 weeks old. I am throwing up green vomit every time my mom feeds me. She's overfeeding me because I'm not keeping it down. And when you see my stomach, I have a mass. It's like a little, it's shaped like an olive or it's shaped like a grape, and it is there. You can see it, but you can also feel it too. And it's just right here. It's an olive-shaped mass, like right in my abdomen. What's wrong with me? I see some people that have it. Yes, I have projectile vomiting, but there's something that's causing the projectile vomiting. And I don't have any allergies. Nope. I thought I saw it. Oh, yes, I saw it. Does anybody know what it is? Yes, people are putting it down now. Yes, it is pyloric stenosis. You got to know pyloric stenosis. Any baby, I had 2 or 3 babies with pyloric stenosis. It's actually pretty common, right? And so you don't have your quick facts book, get into it, all right? Pyloric stenosis, very common. You have an olive-shaped mass, projectile vomiting. The babies won't grow because the food is not getting where it needs to go. What else? No, not a hernia as much, but the projectile vomiting is always a huge indicator. All right, next condition. Checking them off my list. All right, what about this? All right, I'm a grown-up now. I'm a grown-up. I'm back to being a grown-up. I'm a middle-aged woman. I am, I'm generally happy with my appearance. However, I have been noticing that I am fatigued. I am tired. I faint. I started fainting. I didn't used to faint, but now I'm fainting a lot. And my skin, it's a beautiful bronze color, like I've been suntanning, but I haven't been suntanning. But my legs are a little bit darker, all right? My legs are a little bit darker than my, maybe my face. What do I have? Right? I am tired. Things send me into shock kind of. Sometimes I'll just be like, oh my goodness, I can't take it. I'm having stress and anxiety. I feel the stress building up in my body, and I have a bronze color to my skin. It's very beautiful, but it's getting to be too much, right? I'm getting a little worried about it. What is my condition? I see it on the screen. Very good. Everybody says, you got Addison's. You got Addison's. All right. So think about it. We're putting down Addison's, but I want you to take it a step further. What is my treatment plan going to be? When you think about a patient with Addison's, what kind of psychological support do they need? What kind of nutritional support do they need? What kind of diet and exercise recommendations can we give them? This is all how critical thinking works. But I want you guys, when you come to the workshop, to be able to already get to the condition. And so that's what we're going to be practicing, getting to the condition so that you can critically think. You can't critically think about Addison's disease if you don't know what it is. You can't critically think about pyloric stenosis if you haven't studied it. All right. Okay. So, the next condition is this. All right. The last condition was Addison's disease. We're resetting. You come in, you're the nurse. You look at my arm and you see my arm is hot. It's hot. This is around my IV site. And it's painful. I don't want you to touch it. And when you try to start the IV fluids, I tell you, ouch, it hurts so bad. I cannot take it. I can't take it. What is my condition? What is my condition at my IV site? I'm your patient, guys. You got to make me feel better. You have to fix this. You are the nurse. Don't go call respiratory therapy. Definitely don't call the doctor about this situation. What is it? What is going on with me? I don't want you to touch my IV because it's red and it's painful. No, you cannot change the dressing. No, I don't want my medicine through it. I don't want you to do anything. It hurts. It hurts. So you got to educate me as the patient. What's going on? What's going on? I see it on the screen already. You guys are good today. Okay. So the condition that I have is, where am I at? Oh, the condition that I have I'm looking for is phlebitis. I have phlebitis. So I have a list of diseases I have to present to you guys tonight. Good job. Phlebitis is what's going on with me. All right. Know the difference between phlebitis. Okay. Okay. My next condition is this. Are you ready? Phlebitis. Okay. My next condition is this. I am a patient. I was in a motor vehicle accident. And I don't remember much, okay? I don't remember much because I'm really confused. I'm super confused. And when you check my blood, you see that I have a pH of 7.33. What's my condition? And I wanna give me a good condition. All right. I'm looking for an answer. I'm confused after a motor vehicle accident and I have a pH of 7.33. That's enough answer. That's enough right there. All right. I'm your patient. Help me out. Help me out here. Thank you so much. Thank you so much. I'm trying to come up with creative ways to keep you guys guessing. I am. I want you to really be stimulated. All right. All right, here we go. What's my condition? I'm still looking for it. I have a pH of 7.33 and I'm confused. I don't know what's going on. And the pH is significant, so don't neglect the pH in your answer. I want to see something related to the pH. I just don't want to see intracranial pressure. I don't want to see that. Increased intracranial pressure. That's not good enough. Tell me something else that I have. Okay. What is it? Yes. I see the first answer. Somebody got it right already. Yep. It is an acidosis. What kind of acidosis is it? I'm looking for acidosis because the pH is 7.33. So I want you to acknowledge my low pH. I want you to acknowledge it. All right. So it's an acidosis condition. What kind of acidosis is it? Is it respiratory or is it metabolic? What would you say? Is it, if I have confusion, is that a respiratory condition or a metabolic condition? What would you guys say? Oh, all right. So if I have confusion, right? If I have confusion and I am probably going to have what kind of respirations? Are my respirations going to be adequate? Are they going to be appropriate? Or are they going to be inappropriate? Yes, my respirations are going to be inappropriate. They're going to be low. So if my respirations are not adequate, this is a respiratory condition. This is absolutely a respiratory condition, right? Because I'm not breathing, right? I'm not breathing. And so if my respirations are low, I'm not getting a lot of oxygen. I'm actually building up a lot of carbon dioxide. And that is going to turn into acid, right? That's going to turn into an acidosis situation. So this is respiratory acidosis. Share this video. This is it. This is patient evaluation. And whether you're a RN or a PN, you need to know the importance of the pH value. That's it. You need to know the importance of a pH value. All right. This is it. Here we go. Next one is this. New patient. I come in, and I'm not going to keep you guys all night because I want you to be able to decompress after this. All right. So anyways, I'm coming in, and I am hot. It is hot in here. It's too hot. This whole place is on fire. Listen, I am in the wrong place. I am not supposed to be this hot in here. And I'm sweating. I tell you, I can eat all day long. I can have whatever I want, and I'm constantly losing weight. It's so hot in here. All right. What is it? What's wrong with me? What else is going on? My eyes are dry. My eyes are so dry. They're so dry, right? What's the condition? Who's the first person that got it already? I've given you guys so many clues. All right. It's hot. My eyes are dry. Do they look big? And they look like really big. I can eat whatever I want to because I never gain weight. I'm very thin. It's the best. What else is going on with me? I can't sit still. Oh my goodness. I'm irritable. I'm agitated. Hurry up and tell me what I have going on, because this is too much. It's too much, right? My eyes are bulging. They're dry all the time because they're just so big. My eyes are so big. Yes, absolutely. You guys got it. Hyperthyroidism is the patient, is the presentation, and hyperthyroidism or Graves' disease. Either one would have been good. But you guys know those patients, they're not going to give you a long to evaluate them. You got to figure it out quickly. Menopause was a good one. That was a good one, right? Irritable, hot all the time. Close. All right. Next condition is, where do I want to go? Oh, here's a good one. All right. You look at me and you look at my face and you notice my eyes. My eyes, they are, they're yellow. My eyes are yellow. And this is tough. My eyes are yellow and they're runny. I don't feel the best all the time. I have a long history of, I drink a little wine every now and then. I drink wine after dinner. I drink wine after breakfast. I drink wine after lunch. But it's no big deal. I mean, I still have my job. I'm still doing very well. I live in a nice neighborhood. But you notice that my eyes are yellow. What's wrong with me? What do I have? I'm looking for a word. I don't know. You guys know this word? You should. I do have jaundice, but I'm looking for jaundice. What is jaundice? Like, jaundice is like, yes. Yeah. I see the word. Yes, I see the word. Who has it? Claire has it, right? Jaundice is like a symptom, but there's a condition that's causing the jaundice. That's what I was looking for. So, I would have took two things, I guess. I would have took hepatitis, because that's what I was thinking. But I also would have took cirrhosis of the liver. I would have took that too. Okay. Hepatitis, yes, hepatitis C or cirrhosis of the liver. Good job. That was a good job. So make sure that you guys study that. Study hepatitis. If you haven't reviewed it, go ahead and study hepatitis C. All right. That's it. All right, guys, that's it. I am not going to keep you any longer. We went for a good time. Listen, last and final thing I want to say, if you have not signed up for my critical thinking workshop, it is this month. It is coming up October 25th. Sign up for it, please. I'll put the link in this video, or you can go to remarnurse.com as well. It is October 25th. It is going to be prime time, 8 p.m. Eastern. Prime time, 8 p.m. Eastern, and this is for International Nurses Day. So any nurse, wherever you are at, if you know you need some more help or you want to just practice with critical thinking, this is the opportunity. This is the first time I've ever done a critical thinking workshop. And you can see we've had so much fun. We've had so much fun just looking at different types of patients. And so I want to do that, but in a more meaningful way. So sign up for this event. You'll get the workbook. We'll be able to go through it. It will be an intensive study session. It will be like a master class. All right. So all of my critical thinking tips and help I will be giving you guys. Also, if you want to get started before that, remember, this whole month for International Nurses Day, we are doing free shipping all around the world of my virtual trainer for NCLEX. So no matter where you are, to the furthest reaches of the globe, if you are in the Amazon jungle, we will find you for free international shipping, plus not $50, not $100, but $140 off of the virtual trainer right now, this month. So get to signing up, get to getting into the virtual trainer. This is your time. This is your year. We're going to do it together, guys. Remember, I say this all the time. You can, you will, and you must pass NCLEX. See you later. Bye-bye.